Aloka, the innovator in ultrasound. In 1960, Aloka introduced the very first commercially available ultrasound system. In 1983, we invented color flow Doppler technology. And by 2006, Aloka had delivered more than 200,000 ultrasound systems worldwide, the first company to reach this very significant milestone. Today, Aloka is #1 in customer satisfaction among all ultrasound vendors, according to the latest MD Byline survey. It's no wonder, because the innovations we develop are designed to give our customers precisely what they want. High-resolution images for accurate diagnosis, greater ease of use for less user fatigue and increased workflow, and an open platform that works with what you already own and allows for easy upgrades in the future. The ProSound Alpha-7, Aloka's premium, daily-use ultrasound system, meets all of these criteria and more. The ProSound Alpha-7 features innovations that were originally developed for Aloka's flagship product, the ProSound Alpha-10. The Alpha-10 has become an indispensable tool for diagnosis and research, and features unique technologies that are ideal for cardiovascular applications. By incorporating these technologies into the Alpha-7, Aloka is helping to expand your diagnostic capabilities. We're also helping to improve the workflow with a number of friendly innovations. For the sonographer, the Alpha-7 is highly intuitive, with improved knobology, an adjustable control panel, and customizable keyboard, plus tools for easier reporting. For the patient, the Alpha-7 offers shorter scan times and greater comfort, thanks to a wide variety of probes that are smaller and less intimidating, and offer the best fit for each patient. The Alpha-7 also consumes less power, contains minimal lead, and is made with many recycled plastic components. And it's compact and lightweight, which makes the Alpha-7 truly mobile for convenient, anytime, anywhere use. Powerful, friendly, and compact. But that's just the beginning. The ProSound Alpha-7 uses an innovative new approach that allows for thorough examination of the cardiovascular system from every angle, outside of the heart, inside the heart, and the cardiovascular system itself. From outside the heart, Aloka has exclusive technologies that are well suited for dynamic ventricular assessment, with several types of 2D analysis for assessing myocardial motion. To evaluate asynchrony with greater precision, Aloka's free angular M-mode technique compares wall motion at 3 locations simultaneously instead of 1 in real time. To assess both systole and diastole, the Alpha-7 features our unique kinetic imaging automated segment motion analysis. Using a very high frame rate, you get multiple channels of information related to cardiac wall function. Other diagnostic tools include strain analysis and tissue Doppler imaging, both of which are useful for assessing myocardial function. It's widely known that wall motion assessment using conventional 2D imaging varies depending on the skill and experience of the sonographer, but not anymore. With Aloka's 2-dimensional tissue tracking technique, which recently received FDA approval, it's now easy to achieve consistent, reproducible measurements. This results in actual quantitative analysis of tissue damage for more accurate diagnosis of coronary artery disease. Aloka's system helps you inside the heart, too. Having invented color Doppler nearly a quarter of a century ago, Aloka is now making the next big leap forward with vector flow mapping, a proprietary innovation that represents a true breakthrough in hemodynamic assessment. Unlike ordinary Doppler mode, which only shows flow as it moves toward or away from the transducer, vector flow mapping shows the actual direction of blood flow, which saves time and delivers a more accurate diagnosis. Vector flow mapping makes it possible to evaluate regurgitant flow from any angle without the use of contrast media. These images show a tricuspid regurgitation in the right atrium. The vector image, seen on the left, shows that a vortex is created by regurgitation in the atrium. Here are 2 images showing a left ventricular aneurysm. As the vector image indicates, a large vortex is generated near the posterior wall of the ventricle during diastole. This result is simply visible in the Streamlines image. Vector flow mapping even allows for a new index of cardiac function, total momentum of ventricular flow. This graph, created using data from our vector flow mapping analysis software, shows changes of total momentum vector during a heartbeat. The line of strong flow during left ventricular ejection is displayed in the right lower direction, while the line of the diastolic flow is displayed in the upper direction. Aloka's system also makes it possible to evaluate the interaction between the heart and the blood vessels. Now you can assess a patient's risk for atherosclerosis non-invasively, even before their arterial walls begin to thicken. E-tracking is a unique technology that lets you evaluate vessel wall stiffness before an organic change appears. Using the RF echo signals, E-tracking estimates arterial stiffness, tracks the motion of blood vessel walls, and measures changes in blood vessel diameter. You can now estimate a healthy patient's blood vessel age and, if necessary, advise them to improve their lifestyle to help prevent heart disease. Finally, let's look at a new hemodynamic index called wave intensity, which provides the dynamic behavior of the heart and the vascular system and their interaction. In a trial study, wave intensity is being used to evaluate the progression of DCM, identify patients who are at high risk of sudden hemodynamic deterioration, and to gather useful information to decide priority order for transplantation. Comprehensive cardiovascular assessment, made possible by the ProSound Alpha-7. Now you can examine the cardiovascular system from every angle, outside of the heart, inside the heart, and the cardiovascular system itself. Aloka, the innovator in ultrasound.